Welcome to Capital Blue Cross's summer safety presentation, where we will learn many tips and tricks to stay safe when outdoors and in the heat. Today, we will review these agenda items, review heat safety and heat-related illnesses, understand sun safety techniques, and identify potentially dangerous pests, insects, and poisonous plants. Conditions of extreme heat are defined as summertime temperatures that are substantially hotter and more than average for that location at that time of year. Very high body temperatures may damage the brain and other vital organs. Let's do a heat safety knowledge check. Number 1, what is the number one protective factor against heat-related illnesses during the summer? A, drinking water, B, refraining from activity, or C, staying in the air conditioning? The answer is C, staying in the air conditioning. Number 2, true or false? Our body cools itself by sweating. That is true. And lastly, number 3, which is the most serious life-threatening heat-related illness? A, heat exhaustion, B, heat cramps, or C, heat stroke? The answer is C, heat stroke. Heat-related illnesses can occur when your body is exposed to more heat than it can handle and the body is not able to cool itself, resulting in potentially heat stroke, heat exhaustion, heat cramps, or heat rash. There are other factors that affect our body's ability to cool itself, such as high humidity, or some other conditions related to risks include age, obesity, fever, heart disease, poor circulation, and also some prescription drugs or alcohol use. Here are some safety tips to help survive the heat. First, increase your water intake. Don't wait until you're thirsty to drink. You want to drink about 204 or 16 to 32 ounces of water each hour. Extreme heat causes you to lose more body fluid, so avoid cold drinks. They may cause stomach cramps. You want to start slow and pick up the pace. Here are some more safety tips to survive the heat. You want to stay indoors with air conditioning or a cross breeze. You want to stay informed, so things like knowing the temperature, the humidity, and the heat index. You want to eat a healthy diet to stay energized, and pay attention to the signs of heat-related illnesses, such as headaches, rapid pulse, dizziness, nausea, or confusion. We also want to be on the lookout for others. So on hot days, check the back seat of all types of transportation vehicles for children and pets to make sure they're out safely. When you're not in your car, keep it locked. And lastly, check on your loved ones and elderly neighbors during high humidity index days. Now let's review sun safety tips. Here are some sunscreen guidelines. Remember, people of all skin types and colors can get skin cancer from the sun's UV rays. You want to use a sunscreen with an SPF factor of 15 or higher. Before you go outside, about 30 minutes, even when it's cloudy and cooler, you want to reapply every 2 hours or after you've been swimming or sweating. And lastly, just read and follow the instructions on the bottle. You also want to choose your cover. So again, wear that SPF sunscreen. Try to avoid the sun during midday from around 10 a.m. to 4 p.m. Also try to seek shade, wear a wide-brimmed hat, cover up with clothes, and if possible, wear UV protective sunglasses. If you do get sunburn, how can you treat it? Just remember that treatment doesn't actually prevent skin damage. Pain and discomfort can be reduced by a few applications here, so taking an anti-inflammatory medication like ibuprofen, applying a cool compress, applying a moisturizer such as aloe vera or hydrocortisone cream, and then try to keep blisters, if they form, from breaking open. And also remember to stay hydrated by drinking lots of water. These are some tips for when to seek medical attention if you are sunburned. So if your sunburn or blistering covers a large area of the body, if you're experiencing high fever, extreme pain, headache, confusion, or nausea, if other treatments aren't helping, if you see increased pain, tenderness, or swelling, if pus drains from open blisters, or if red streaks are leading away from open blisters. Now let's review pest and insect safety tips. Let's start with a pest and insect knowledge check. Number 1, ticks transmit Lyme disease in animals. Pennsylvania is actually number 1 in the United States for the number of reported cases of Lyme disease. Number 2, true or false, ticks can jump. That is false. Number 3, mosquitoes can transmit West Nile virus to humans. Which animal transmits the virus to mosquitoes? The answer is birds. Number 4, true or false, only female mosquitoes bite, and that is true. And lastly, number 5, the red itchy bumps from a mosquito develop because our skin is reacting to. The answer is C, the mosquito's saliva. Here are some tips to help reduce exposure to ticks and mosquitoes. Remember, the higher the percent of the DEET concentration, the longer the protection. Higher the percentage, the greater the protection lasts longer. Here are some more tips for reducing your exposure to ticks. Be sure to do a tick check under your arms, around your ears, inside your belly button, the back of the knees, in your hair, and on your scalp. Here are some tips for what to do if you're bitten by a tick. Remember, don't twist or jerk the tick. This can cause the mouthparts to break off in the skin. If this happens, remove the mouthparts with tweezers. If you're unable to remove the mouthparts, leave it alone and let the skin heal. According to the Centers for Disease Control, if you remove ticks quickly within 24 hours, you can greatly reduce your chances of getting a disease. Here are some tips for what to know about Lyme disease. Ticks, especially the tiny nymphs, can attach to any part of the body, and they generally leave a rash. The rash won't hurt or itch, but it can come with fatigue, chills, fever, and body aches. Lyme disease is treated with antibiotics. If you've been bitten by a tick or have been in areas where ticks are common and have an unexplained fever or rash, see your healthcare provider. Here are some Lyme disease facts directly from the Centers for Disease Control. Some symptoms of Lyme disease may begin 3 to 30 days after a tick bite, average around a week or 7 days. Of people who get Lyme disease, 70 to 80% actually develop the rash. The ticks that transmit Lyme disease can sometimes cause other diseases too, and only the black-legged ticks transmit the bacteria that cause Lyme disease. Here are some tips for reducing your exposure to mosquitoes. Try to stay inside. A lot of times mosquito bites they occur between dusk and dawn. Mosquito-proof your home, pets, and livestock, and try using bug zappers or citronella scented candles. Here are some tips for what to do if you're bitten by a mosquito. For insect safety, bees, wasps, and hornets can produce different reactions. Much of their reactions are usually localized to minor swelling and itching directly on the location of the sting, but some can cause severe allergic reactions like anaphylaxis or trouble breathing. Some signs and symptoms of bites and stings to be aware of are red welts around the sting area, small white spots where the sting punctured the skin, instant severe pain at the site of the sting, and swelling around the sting area. Listed on the screen are treatments for stings and bites. When to seek immediate treatment? If there are signs of severe reaction, which could be if the sting or the bite is near the mouth, if you have a known severe allergy to the sting or bite, if you use epinephrine, or if there's severe swelling, pain, or pus for longer than a few hours. Here are some prevention tips. So hairsprays, scented soaps, or perfumes have been known to attract stinging insects. Try to avoid areas where these insects tend to congregate, and wear shoes, especially outside and in the grass. Now let's review some plant safety tips. For poison ivy, remember leaves of 3, let it be. They're typically identified as a hair rope-like vine with green shiny leaves or identified as a low shrub. Poison sumac, remember don't be a grub and watch out for this shrub. It's a woody shrub with stems containing 7 to 13 green leaves arranged in pairs. They may have glossy, pale yellow cream-colored berries. And lastly, poison oak, again, leaves of 3, let it be. Typically identified as a shrub with 3 green leaves, shaped like oak leaves or as a vine, and they may have yellow or green flowers and clusters of berries. Here are some tips for reducing your exposure to poisonous plants. Try to wear long sleeves, pants, boots, and gloves when working outside. When exposed, wash exposed clothing separately in hot water. Wear disposable gloves. You can use a barrier skin cream. And after using tools outside, clean appropriately with rubbing alcohol or soap and lots of water. And avoid burning plants or brush piles that may contain poison. Here are some treatment options if you're exposed to poisonous plants. You can apply wet compresses, calamine lotion, or hydrocortisone cream. Try taking an oatmeal bath, taking an antihistamine such as Benadryl. And remember that if the rash is on the face or genitals, or if a severe reaction has occurred in the past, seek medical attention. Call 911 or go to the ER if a reaction causes difficulty breathing. Be sure to check out these Capital Blue Cross resources for more information. Here are some references for today's presentation and Capital Blue Cross's outdoor safety presentation.